spent time in two different hospitals in Accra, which is the capital city of Ghana. One of them is called Korle Bu Teaching Hospital, and the other one is 37 Military Hospital. 37 Military Hospital is kind of the smaller of the two, so we spent a little bit more time at the Korle Bu Teaching Hospital. They are actually the second largest hospital in all of Africa. And just for perspective, there are patients that come in from other neighboring countries that don't have the facilities in their home country, so they travel to Ghana to receive this care.
So it turns out there's probably fewer than 100 radiologists in the entire country of Ghana, which I learned. The ability to teach in real time was rarely available to them, and we provided that.
One day I spent doing biopsies on patients. The fellow who I was working with was incredibly smart, really wanted to learn, really wanted to do, what she was there to do, but unfortunately hasn't had that much experience or exposure or being taught how to do a biopsy. So that's a huge opportunity for us to kind of make a difference.
One of the residents, he asked me, can you come in? And he couldn't make out the scan. He thought what he was looking at was all gallbladder, and because it just wasn't normal. And so I showed him how it was a normal gallbladder, but it was his bile duct. This little boy's bile duct was 30 millimeters. We're still trying to figure out why it's so dilated. I said, well, let's go ask Dr. Phil. And the resident looked at me and his eyes just bulged out that he could get a doctor to come in and work through a diagnosis.
I immediately, as well as Wendy, impressed upon them that that's why we're here. And we want to answer your question.
Some of the text, we were able to show how with a different type of positioning, you can get more breast tissue. If you're getting folds, what to do. And they were like just oohing and ahhing. They needed that.
But with the mammograms, sometimes patients need 2 pictures. And when we started, they were just taking 1 picture and having really big folds. And by the end of the week, they were doing those 2 extra pictures without us having to, recommend to do another picture. They knew that, okay, to get the best images, we need to do another one. And they were really understanding what we were asking them to do to get the best pictures for these patients.
The Korle Bu Teaching Hospital has a breast MR coil, but they don't have a breast MR protocol. So the technologists and the radiologists there don't know what sequences to do. So myself and Chad, an MR tech who came with us also, were able to create a brand new breast imaging protocol for them. They were so excited to have it. We actually scanned our first patient with the new protocol and were able to see some of the images and the quality. We decreased the imaging time for them by half and increased the efficiency. So it was wonderful. They were just so thankful.
At the end of the trip, it was actually sad to say goodbye to them. Yes, we were only there for a week, but I felt in that week we made such big progress and felt like family when we were there.
It's always good to give back. It's people that need it. It's wanted around the world. RP is doing it in a big way. I really appreciate that.
Radiology Partners is now probably the world's largest repository of experience and radiology expertise in the world. That is a gift that we have. It is internal wealth that we have that we must share with the world because it's the right thing to do.